Hi, hello, welcome to Future Nurse YouTube channel. Please subscribe and support our channel. So let's start today's video. So the first question is, which one of the following cancer that does not metastasize commonly to liver? So options: breast, lung, colon and prostate. So this video is like practice paper, so please comment your answers in comment section. So moving on to the next question. So direct action of parathyroid hormone include everything except increased resorption of calcium from bone, increased absorption of calcium from intestine, increased reabsorption of calcium from kidney, increased production of 125 dihydroxy vitamin D. So next, all of the following cancers have ineffective etiology except squamous carcinoma of penis, squamous carcinoma of lung, Burkitt's lymphoma, Kaposi's sarcoma. So next, all are true regarding vitamin A except it is found in green leafy vegetables, high dose in pregnancy and is tetragonic. Supplementation reduce mortality in measles. Supplementation reduce morbidity in diarrhea. So moving on to the next question. What is the best way to be adopted by a nurse to avoid hematoma formation when undertaking vein puncture? Choose a vein that is soft and refills fast. Tap the vein hard before vein puncture. Apply firm pressure for 1 minute after procedure. Apply heparin containing ointment after procedure. So next. So moving on to the next questions. Nurse giving oxygen therapy should know that it has to be humidified because oxygen is hot air and it may burn trachea. Oxygen is a dry gas and thickens the mucus. Oxygen gets cleaned off pathogens by humidification. Oxygen is easily absorbed because humidification adds H ion to it. So comment your answers below. Nurse engaged sorry Nurse engaged in suction process of tracheostomy in situ patient who requires frequent suctioning. How long she should do suctioning every time? 15 seconds, 30 seconds, 45 seconds, 60 seconds. Please comment your answer. Nurse taking care of a pregnant lady is being asked about when to start breastfeeding. What should be her appropriate reply? 2 hours after delivery, 4 hours after delivery, 6 hours after delivery, 8 hours after delivery. So next, a nurse must be aware that eating maize alone can lead to beriberi, pellagra, scurvy, perinodoma. So please mention your correct answers. A nurse observes Palmer erythema and she understands that it is met within cardiac failure, renal failure, hepatic failure, adrenal failure. So which of the following failures? When helping a stroke patient, nurse should assist on weak side, on strong side, from behind, from back, on from which side they are asking. To avoid pulling the urinary catheter, nurse should tape the catheter on patient's upper thigh, lower thigh, hind leg, foot. So next question. 16-year-old primary gravid patient admitted with severe pregnancy-induced hypertension (PIH) is given intravenous magnesium sulfate. The nurse should obtain which one of the following information? So options: urinary output every 8 hours, deep tendon reflexes every 4 hours, respiratory rate every hour, blood pressure every 6 hours. Okay. So next question. Which one of the following nursing measures would be most appropriate in the care of the patient who has acute epistaxis? So options: tilt the patient's head back, place the patient's head between his legs, pinch the nose and have the patient lean forward, place warm compresses on the patient's nasal bridge. Okay. So next question. Which of the following actions would a nurse take first when caring for a patient experiencing a cardiac arrest? Initiate cardiac monitoring, provide intravenous access, establish an open airway, obtain a pulse oximetry reading. So moving on to the next questions. When caring for a patient who has intermittent claudication, the nurse advises the patient to apply graduated compression stockings, elevate the legs when sitting, restrain from vigorous exercise, walk as much as tolerated. So next, a lethargic patient has fever, vomiting, headache, and the nurse has to prepare him for which one of the following procedure? Blood culture, lumbar puncture, CAT scan, ultrasound examination. So next, an active male patient who weighs 180 lb means 81.65 kgs has undergone dietary instruction. The patient reports that his current diet consists of 60 gram of fat, 200 mg of cholesterol and 5 gram of sodium per day. What a nurse advises the patient to do? Increase his cholesterol, increase his sodium, decrease his cholesterol, decrease his sodium. So next, a 55-year-old male patient who is diagnosed with evolving myocardial infarction (MI) insists on going home. The nurse encourages the patient to be admitted because the greatest risk within the first 24 hours sustaining an myocardial infarction is heart failure, sudden death, pulmonary embolism, ventricular aneurysm. So friends, we have come to the end of the video. So please subscribe and support our Future Nurse YouTube channel for your upcoming AIIMS NORCET in 2024 and other competitive nursing officer examinations. Thank you.